Dr. Peterson is a radiation oncologist. She went to school at Auburn University and trained at Medical College of Georgia, did a residency and fellowship with us at Mayo Clinic, and has been with us since 2011, I believe. So we all see patients that we can't cure or treat surgically and they need radiation, and she will give us some ideas and options of what to do and when to send them to her.
Thank you, Dr. Lundy. It's a pleasure to be here. I'm going to talk today, the first half of my talk, I'm going to spend talking a little bit about our different technology and how that's changed and what some of our different types of radiation are. And then I'll finish with a couple of examples of what we're doing in the field of radiation oncology to improve outcomes for our patients. So I'll start off simple. What is radiation? It's simply the emission of energy, either through electromagnetic waves or through particles. And as you look at the electromagnetic spectrum, as you increase in energy, radiation becomes ionizing, which means it has the ability to eject an electron out of an atom. And for comparison, when we talk about diagnostic X-rays, those are typically operated in the kilovoltage range. Therapeutic radiation is actually operated in the megavoltage range. Radiation works by damaging the DNA, and it can do this by either a direct method where the electron that has been ejected damages the DNA, or it interacts with a water molecule and generates a free radical, which then damages the DNA. It can cause a lot of different types of damage, the most common being base damage, but it can also do single-strand DNA breaks as well as double-strand DNA breaks. There are a couple things that can happen when the DNA is damaged. The tumor or the cell can actually die or necrose. It can undergo a programmed cell death or apoptosis, and we hope this is what happens to our tumor cells when they interact with radiation. The cell can also repair itself and eventually survive, which is what we hope happens to normal cells when it interacts with radiation. The difference in what radiation tries to maximize the difference of is that tumor cells do not have the same repair capabilities that normal cells do. And so when they interact with radiation, they cannot repair themselves and will ultimately die. Whereas normal cells do have multiple mechanisms inherent to them that will help them repair the damage that is done. And so the hope is that the normal cells will recover with time. That's part of the reason why we fractionate our treatments or give them a little bit every day over the course of several weeks, is because the normal cells on a daily basis will repair themselves. And so the tumor cells will gradually die, whereas the normal cells will sustain over time. There's a third possibility too. Sometimes the normal cells will have some damage from the radiation, and that will create some genomic instability, and over time there are rare cases where radiation can actually induce or cause a tumor. Our field has really evolved over the past 70 years. The picture on